Hello everyone and doctor, we are from SGD B4. We'll explain about our student project by the title of Complication in Management Post-Stroke. This is our members, and this is the outline of the paper that will be explained each by our members.
Hello doctor and friends, my name is Giovanka Purnama with student number 148 and I will explain about the background of post-stroke syndrome. So stroke itself is a syndrome in speech, sensory and motoric and lasts more than a day, which caused by brain damage. Stroke itself is the most common non-communicable disease in the world. Stroke also became the second top of non-communicable disease with high mortality based on World Health Organization. After being treated by several medicines, patients with post-stroke had to undergo rehabilitation and further treatment for the rest of their life. However, not all patients had adequate accommodation and knowledge about the post-stroke rehabilitation, which may lead patients to post-stroke complication. Post-stroke is a condition after stroke that might be prevented from bad output with sufficient knowledge. Because of the lack of knowledge in public about post-stroke and how to manage patients after stroke, the writers want to discuss more about what is post-stroke, the etiology, epidemiology, pathophysiology, complication, prevention, and its management. And here is the research question and the purpose of the writing.
I'm Vicky Samantha with the last 3 digits of student number 079. The World Health Organization has defined stroke as rapidly developed clinical signs of local or global disturbance of cerebral function lasting more than 24 hours or leading to death, with no apparent cause other than of vascular origin. This means stroke is a condition where the brain cells are damaged due to lack of oxygen caused by the disturbance of blood flow to the brain, which can disrupt some nerve function locally or globally, and it appears sudden, immediate, and progressive. Stroke itself is divided into 3 categories: ischemic stroke, hemorrhagic stroke, and subarachnoid hemorrhage. Where ischemic stroke is caused by blockage in the blood vessel and restrict blood flow, hemorrhagic stroke is caused by blood spill from a ruptured blood vessel that settled in the intracranial cavity, and based on the site of spillage, it's divided into intracerebral hemorrhage and a subarachnoid hemorrhage.
Hello, my name is Nada Pramesti with student number 167. Now, I want to tell about stroke epidemiology, especially in Indonesia country. Stroke is the leading cause of death and disability doing activity living in the world. In 2013, 25.7 million stroke sufferers worldwide and 6.5 million died from a stroke. The percentage of stroke incident in developing countries is higher than in developed countries. One of which is Asia. More than 60% of the population in Asia has a stroke. Hypertension is still the dominant risk factor for stroke, followed by diabetes mellitus, hypercholesterolemia, obesity, and smoking. But smoking in Indonesia is the highest cause of stroke in Asia than other disease risk factors. The prevalence of stroke in urban community is higher than in rural community in Indonesia. The highest prevalence of stroke in Indonesia occurs in North Sulawesi, followed by the second rank in Yogyakarta province. This is also due to an increasingly old age and unhealthy lifestyle which can eventually lead to chronic disease. Therefore, to help reduce the incidence of stroke, 2 strategies can be done, namely with primary, as we can change our lifestyle with exercise, good food, good drink, and etc. And secondary, we can take medication if we don't feel good with our body. Thank you.
My name is Samantha with last 3 digits of student number 066, and I'm going to explain about the pathophysiology of stroke. There are 2 types of stroke: ischemic or non-hemorrhagic stroke and hemorrhagic stroke. Ischemic stroke can be caused by thrombosis and emboli. In thrombosis, reduction of blood flow is caused by beta plaque of atherosclerosis, whereas in emboli stroke, reduction of blood flow is caused by embolism. The reduction of blood flow on both cases will lead to high stress and necrosis of cell, and eventually also lead to the function loss of neuron cell. On the other hand, hemorrhagic stroke can be divided into 2 based on its location: intracerebral and subarachnoid stroke. On most cases, intracerebral hemorrhage is caused by hypertension, but also may be caused by disruption vasculature and excessive use of anticoagulants and thrombolytic agents. In subarachnoid hemorrhage, as it names, Blood accumulates in subarachnoid spaces of the brain and has multifocal effects on the brain. Subarachnoid hemorrhage also increase intracranial pressure and damage cerebral autoregulation. This type of hemorrhage might be caused by injury or cerebral aneurysm. Thank you.
Hello, my name is Dandi Prema, with the student number is 182. So next I want to explain about the etiology of strokes. So strokes can be classified into two major categories, ischemic and hemorrhagic stroke. Ischemic stroke occurs because of a blockage in the blood vessels that supply blood to the brain. The causes of obstructions is an increase in fat deposits that line blood vessels are known as atherosclerosis. These conditions then causes two obstructions, namely cerebral thrombosis and cerebral embolism. The second one, hemorrhagic stroke, is the result of the rupture of blood vessels and causing bleeding around the brain. The blood that comes out will accumulate and presses on the tissue around the brain. This is caused by two things, namely aneurysm and arteriovenous malformation. So that's all about the etiology. Thank you.
Complication of post-stroke. Stroke is the second leading cause of death in the world and can lead to serious long-term disability. Medical complication can increase mortality, cost of care, extend the length of hospital stay, and delay the rehabilitation time. If this complication can be detected earlier, they can be prevented or treated. The post-stroke complications include cardiac, pulmonary, gastrointestinal, and genitourinary complication. Cardiac complication. First, myocardial infection. Stroke patients have a high risk of having an early myocardial infection if they have coronary artery disease, peripheral vascular disease, diabetes, and severe stroke. Myocardial infection is very crucial because it can cause cardiac death if there is prolonged ischemia. Second, cardiac arrhythmia. The incidence of cardiac arrhythmia is uncertain, especially in the first few days after stroke. Cardiac arrhythmia, including supraventricular tachycardia, atrial fibrillation, ventricular tachycardia, and ventricular at quick beats, can cause hemodynamic instability and increase the risk of cardiac death. Pulmonary complication. Pneumonia is one of the most common medical complications of stroke and increases the risk of death 3 times. Pneumonia is the most common cause of fever in the first 48 hours after stroke. The risk of difficulty swallowing after stroke can cause things to go in the wrong channel, leading to aspiration pneumonia. Old age, speech disorder, dysphagia, decreased level of anxiety, infection, severe facial paralysis, and mechanical ventilation are risk factors for pneumonia.
The next is other complications such as infection. Infection can occur due to pneumonia and urinary tract infection that also along with fever in the first 48 hours that should be open a common source. The second is fall that can be occur up to 70% of the patient that have a risk factor of cognitive impairment, anosognosia, and polypharmacy. Fall alone can cause fracture up to 45%, which are hip fracture on the paresis side. The last is depression. Depression can be also occur in the 1/3 of the patient that have a post-stroke depression with 55% occurring in the first years. The cause is a combination of physiological and biological factor along with the treatment using pharmacological and non-pharmacological way.
Good evening, doctors and friends. My name is Ardejita Pramesti, student number 044. Now I will continue the presentation. So in making diagnosis of the stroke, there are multiple steps. The first one is initial history. As we all know that history is very crucial in making diagnosis of the stroke. It's including the onset of the stroke, the past and present personal and family illness, brief overview of the patient's background, especially the vascular risk factors, because it will influence the diagnostic of the decision process. The next one is clinical presentation and examination. So clinical presentation of the stroke depends on the area of the brain that affected by occlusion of the arteries. In the pre-hospital setting, there are acronym that is popularized. It's FAST. It stands for facial drops, arm weakness, slurred speech, and time of onset. There are another acronym that is 6S: sudden, slurred speech, side weak, spinning, severe headache, and seconds. And we're continuing to performing the National Institute of Health Stroke Scale, or an IHSS. It is used to identify the affected vascular territory and to quantify physical impairment. And the next slide will show you the scale, the National Institute of Health Stroke Scale. And the last one is radiographic diagnosis. So differentiate the stroke and non-vascular process such as brain tumor, metabolic disorder, etc. It really depends on the brain imaging. The first one, we can do the non-contrasted CT. It's quick, sensitive, and cost-effective at ruling out intracranial hemorrhage. Also, we can use multimodal CT. Imaging comprises CT perfusion and or CT angiography. And the last one, we can perform MRI. MRI has much greater sensitivity for ischemia than CT compared to the CT, but unfortunately, it limited in accessibility and safety and the potential for a clinically significant delay in instituting treatment. Thank you.
Hello, my name is Igus Diagung Anasuri Rama with student number 15. Now I will explain about the differential diagnosis of stroke. The diagnosis of stroke can be confusing as some conditions may present similar symptoms to stroke. Therefore, considering other probable diagnoses that might cause the presenting symptoms is highly recommended. The conditions that might present similar symptoms are intracranial tumor, subdural hematoma, epileptic seizure, metabolic or toxic encephalopathy, cerebral abscess, viral encephalitis, hypertensive encephalopathy, multiple sclerosis, head injury, peripheral nerve lesion, psychogenic, Creutzfeldt-Jakob disease, cervical core pathology, transient ischemic attack, and hemiplegic migraine.
My name is Anak Agung Rahpanana Anantadiva. Now I'm going to explain about the management of post-stroke. So, stroke is a common serious and disabling global health care problem, and rehabilitation is a major part of patient care. Stroke rehabilitation measures can be divided into several phases, namely, the first one was acute phase. The acute phase of rehabilitation is carried out in the first 2 weeks after a stroke. The program in this phase is run by a team, usually starting after the process is stable and is after 24 until 72 hours after the attack unless bleeding occurs. The acute phase of rehabilitation include management of dysphagia, management of aphasia, prevention of pleasure occur, prevention of falls, prevention of pain and sensory deprivation, and prevention of pain and deep vein thrombosis. The second one was subacute phase. In this phase, rehabilitation is carried out between 2 weeks and to 6 months after stroke. The goals of rehabilitation in this phase are to optimize neurological recovery, and then continue acute phase therapy, exercise therapy, and group therapy to improve quality of life and self-concept, and many more. And then the third one is chronic phase. This exercise of rehabilitation program for the chronic phase lasts more than 6 months after stroke. And then the purpose of this chronic phase of exercise program is to optimize the patient's functional ability, maintain the functional ability that have been achieved, optimize the patient's quality of life, and prevent complications. Thank you.
My name is April, student number 237. So I would like to continue explaining about the management of post-stroke. So the first one, additional lifestyle measures such as stoppage of smoking, sufficient physical activity, and healthy diet are more factors that should be monitored and recommended on long-term neurocardiovascular prevention strategies. Meanwhile, the premature antithrombotic secondary prevention should be set as soon as possible after diagnosis has carried out. In general, antiplatelet therapy was established as a first-line therapy in patients with stroke. In patients with atrial fibrillation, oral anticoagulation can be started within 4 until 14 days after the rest of depending on the size of brain injury. At the end, a persistent patent oval foramus or PFO is a significant finding that can explain paradoxical embolization in patients with stroke of unknown origins.
Next is prevention of stroke. There are many ways to prevent stroke. For the prevention itself, it is important to controlling the modifiable risk factors, such as the first one, maintaining the healthy number for blood pressure. Second one is about diabetes, which diabetes is one of the disease that has further associated with hypertension, obesity, and abnormal lipid profile, or become the other risk factors of stroke. So, diabetes patients who have had a stroke must apply the guidelines for glycemic control, blood pressure target, and lipid control. The other habits that must be changed to prevent stroke are not smoking, limiting alcohol intake, and also doing regular exercise by burning 2,000 until 3,000 calories per week, so it could reduce the risk factor for stroke.
To summarize the explanations earlier, stroke is a combination of clinical signs that show cerebral function disorders due to disturbance of blood flow to the brain.
Post-stroke complications can occur in 3 phases, which are the acute phase, subacute phase, and also chronic phase. These complications may involve cardiac, pulmonary, genitourinary systems, as well as the psychiatric issues. Public lack of knowledge about post-stroke complications and its management often be the main cause of post-stroke complications and stroke itself occurring at a high rate. The management of post-stroke complications involve lifestyle modifications and monitoring as a form of long-term care to prevent stroke recurrence.
Okay, that's all about our presentation. Thank you for listening.